Good morning and welcome to the program Perspectives. Perspectives this morning is brought to you courtesy of Kaduna State Ministry of Health. And of course, here we talk about COVID 19 and where we are with this uh, disease, so to say. And of course, there's a lot of people talk about this infection that is ravaging uh, people all over the world. And this morning we'll be talking about what is happening the world over in Nigeria and back here in Kaduna State where we all are. Okay, COVID 19, and we know that the lockdown has been over in Nigeria and Kaduna State too. But what are the things coming out after the lockdown? And of course, talking about the protocols, how much how well are we observing the protocols of COVID 19? And of course, we all know that the markets are open now. We have schools now opened, but again, what we have to do to stay safe and stay alive. This morning, my guest on the program, Dr. Zainab Idris Kwaru, public health physician, as a consultant public health physician with Kaduna State University, also with the emergency unit of COVID-19 in Kaduna State. Dr. Zainab Idris Kwaru, good morning and glad to have you on our show.
It's my pleasure. Good morning, Gary.
Yes. Well, lockdown has been over and we're all enjoying our freedom, so to say. We freedom in quotes now from COVID-19. But how well are we doing with COVID-19 and the protocols that we have on ground?
Thank you very much. A very good morning to our listeners. I believe we're in an era where the Kaduna State government is providing us an opportunity to move forward with our life. And moving forward is something that we all need to take responsibility for, which means all of the safety measures, all of the preventive measures need to be complied with. As it is, we still have issues with people obeying or observing the guidelines that have been provided, while some take the extra effort to ensure that they remain safe by doing all of the preventive measures that we have emphasized over time, which are making sure that we observe the respiratory etiquette or the cough etiquette, as people may call it. Whenever we cough or sneeze, making use of a tissue and disposing of it properly in a dustbin, and then making sure that if that is not available, we use the crook or the bent elbow to arrest any cough. People observe these measures, but a lot more are still nonchalant about it. And then the second preventive measure is ensuring that we maintain hand hygiene, which is making sure that we wash our hands regularly with soap under running water, and where that is not available, making use of an alcohol-based sanitizer. That's the second key preventive measure. And then we also have to maintain the social distancing. While you see others making an attempt to do that, we again still have individuals that disregard this very important preventive measure by crowding themselves and not maintaining the 2-meter distance or the 6 feet that we emphasize on. And then, of course, the use of the face mask, which should be mandatory, and it is mandatory. You go around neighborhoods, you go around communities, and you still see people flouting that rule. Sometimes they tell you they have the face mask and they wear it on their chin. And that, again, is not really the right behavior to adopt. And we see a lot of people going around with such masks in their pockets, in their bags, and not really using them. So moving forward for us, it's very important. Very important so that the cases do not keep rising, and then we're able to keep the Kaduna citizens safe if everyone will comply and adhere to those preventive measures that I've just outlined. So for now, if you look at the statistics that we have today, for this morning, for Kaduna, we have a total of 1,882 cases that have so far been confirmed since the beginning of the pandemic, out of which we have 225 cases that are currently active, with about 1,630 that have been discharged so far. We've recorded 27 deaths, which puts our case fatality rate at 1.4%. And of course, we're still on it. The individuals that are commonly affected are those within the age range of 35 to 39 years, and with a lot more of our young people also experiencing the infection. And then we have local government that are mostly affected. Kaduna North is in the lead. We have Chukun, Kaduna South, Igabi, Zaria, Sabon Gari, and virtually almost every local government in the state has experienced or has recorded one case or the other. So that's the situation that we are in. Markets have been opened. People are beginning to come out en masse. They are mingling with each other. Public transport's overcrowded. So we still have issues. And I think people should really realize that there's still a lot more to be done. The fact that there's an ease and there are opening of spaces does not imply that the COVID-19 has gone. It's still very much with us, and it's still very much real, and we need people to really comply for us to be able to achieve the goal of keeping people safe.
All right, Doctor, what makes our case different? I'm making a comparison here with what is happening the world over. America, as a case, here, is that schools were reopened, and we saw what happened in some states of America, that COVID-19 just went on the rise again. We see what is happening in Australia too. And then coming back home, is it a case of not reporting in Nigeria, or that we are just lucky people, so to say?
I think we should not be complacent. This is the time for us to actually tighten our belts and to be on top of our issues in terms of ensuring that we do not leave anything to chance. Those other countries have experienced a resurgence, like you said, and nothing stops our own from also getting a re-emergence of the entire situation if care is not taken. And that's why we are particularly concerned about getting our people to do the right thing, to change their behavior for the better, and to realize that in as much as we're getting things, going on well for us at this moment, it does not mean our cases are not increasing. And we wouldn't want a situation where later on, with such attitude going on, having cases that will be overwhelmed, our systems can be overwhelmed, and then you know what that means in the long run. So we are really, really craving on the indulgence of our people to realize that we have so much going on for us. So much effort has been into containing the spread of the pandemic, and it's important for people to cooperate with government and to see that cases do not rise in our own environment.
Yeah, we'll come back to Kaduna State. At the heat of it all, we saw what measures were put in place by the state government, Kaduna State government. And for some people outside Kaduna, or the state of Kaduna, these measures were said to be like harsh on the people. The lockdown that had to do with not allowing interstate transport to go, and keeping the people under lock, and business activities and everything was put on lock. But again, we saw what that did for Kaduna State, that it helped in curbing the spread of this infection. But again, we're saying that now we are on our own. The government had done its own part by telling us what to do. Of course, what we are doing now, the dissemination of information, is also about still keeping us, with the reality of COVID-19. Now that we are on we are on our own now. Again, we see that you've talked about it. That looks like we've just gone let down our guards, and so the fear of these infections still going all round. What can we do? You've talked about how we must keep to the protocols, but for some people that would want to stay safe too, and others who just think that the reality of COVID is just a myth. How do we address this situation?
We'll continue to reinforce our messages. We'll continue to emphasize those messages, and we'll continue to also ask people to be on the lookout to see what is happening in their environments. More and more cases are coming down, not because effort is not being put, but because people have been nonchalant and disregard the safety measures and the preventive measures and the guidelines and directives that government has put out there. I think virtually every sector that we have in the state has a befitting guideline or protocol that has been specified on what and how we should conduct ourselves. And the forward campaign that I keep mentioning has to do with making sure that we comply with all of the preventive measures. For instance, when we look at F in the forward, it means making sure that we wear our face masks consistently and without any compromise, especially when people venture out of their homes and they're out there. And then secondly, observing those measures that will help us maintain our respiratory hygiene, making sure that whenever we cough, like I said earlier on, we obey and we follow the right. Let it even become a culture with us. Let it be something that we're used to doing. Even before the COVID-19, I know that is part of good behavior for us to make sure that we don't just cough in the air. And we teach children to also do such things. It's a practice that a lot of people really, really need to be very used to and be practicing. And then we have the respiratory, the respiratory hygiene, and then making sure that we observe all of the safety measures in terms of keeping the distance whenever we're in a crowd or whenever we are more than one person. There's a need to maintain that 2-meter distance or 6 feet. And it's very important because it's one of the ways of curtailing the spread of the virus. When people keep that distance, it's not likely that even if one has the virus and he coughs or sneezes and lands on any form of surface, that 2-meter distance is a means of breaking that transmission. And then we have issues of making sure that while if it's not important, if any travel or venturing out of our homes is not an essential going out, is not essential, it's very important for people to stay in one place. Again, it's one thing to continue venturing out so that we're not exposing ourselves to unnecessary risk of contracting the virus. Of course, it's important for people to also maintain a healthy diet because we know that a healthy diet will help us maintain and boost our immunity. And that can also prevent any complication peradventure that one comes down with the infection. And so on and so forth. So it's very important for us at this moment that places have been opened, places of business, places of schooling, and then people going to their offices or their daily affairs. It's important for us to take that personal responsibility so that we are safe and we keep our families safe, and then we also ensure that we do not expose ourselves unduly to any risk of infection.
I've had people ask me, that when we talk about, diet, and we begin to ask, what kind of diet are we talking about, and the economic situation of the country, does it affect the kind of diet that we can, introduce into homes with what is happening? The diet you're talking about, what kind of diet would you introduce or tell people to keep to?
That's a very interesting way of looking at it. But I think it's very important for people to realize that we have to eat anyway to survive, whether COVID or no COVID. But then with the COVID, it's important for us to particularly look at to what we eat. For instance, it's not about spending money to get all of the needs or the nutrients that we require to remain healthy. We have our local food items that are known to be rich and highly nutritious. So all we're asking is for people to maintain that. There are already things that we're used to eating. And like I said, we have to survive anyway. So whatever we do, we make sure that we remain healthy. The highly nutritious food that will keep us, build our energy, ensure that we have a build-up of any loss in terms of those that will support us in building our structure. And then those ones that will help keep any infection at bay, like the vitamins, the minerals, and what have you, which also boost our immunity, are the things we're asking people to abide by. We have them locally, the local food items that they're used to eating. So we should make sure that they are nutritious and highly, they are adequate in terms of quantity and the quality of the food that we eat.
In all of this too, stigmatization is coming out to be an issue with addressing COVID-19, and of course discrimination. For testimonials that we've had, some people are finding it difficult, especially those that have been infected and coming back to the community, and how they are being looked at. And so addressing this situation, what would be your take on this?
Well, I didn't quite get you. Can you?
I'm talking about discrimination and stigmatization with the COVID-19 pandemic that we're having. Some people that have been identified as, with COVID-19 and coming back, again, we're talking about the lucky ones who had come back to the society, how we're looking at them. There seems to be a lot of discrimination and stigmatization going on now.
Yes, I think it's rather unfortunate because COVID-19 is unlike other ailments where people are stigmatized because of the perception of fear, or the perception that they are different, or the perception and the fear of the unknown. Because a lot of the times what fuels the stigma is because people do not have a deep understanding of what is happening. And then the fear of contracting the infection, where they themselves don't even know whether they already have it or not. So these are issues that we still have. And I think it's important for people to note that COVID-19 is not a death sentence. COVID-19 is something that we need to prevent its spread. That's simply the message that we're emphasizing. Not for individuals that have gone through the experience or that are perceived to be carrying the infection to be disenfranchised, or for their rights to be abused, right to association, right to freedom of movement, and so on. So I think it's important for people to dispel any misconception that can lead to stigmatization. People that have gone through the infection, or that are doing their best to take care of individuals that contract the infection, should not be discriminated against. Instead, we should have some level of empathy. We should also be able to support them as much as we can for them to get over the condition and to live, a normal, functional life.
Again, I just want to put this across too. We're talking about in other climes. I have seen videos in other climes where those that come out, have been treated of COVID-19 and they're being celebrated. But we have the other. We're looking at it the other way here, that you're still on stigmatization, that people want to give a long distance from from people like this. So what makes it different from these crimes?
Well, for us, like I said, I think people are a bit ignorant about the causes and the mode of spread of the infection, and that tends to make people fear and to act irrationally. And it's important for people to understand that once they take those preventive measures, it's not likely that they can get infected. So that fear should be deflated, so that they understand the dynamics involved in the spread of the infection. And that's why we kept emphasizing that individuals should take personal responsibility for their action and personal responsibility to stay safe, so that they do not unnecessarily or unduly expose themselves to the risk of getting the infection. And then additionally, for those who may have been unlucky to have the infection, like I said, it's not the end of the world. Once they do not hide their condition, once they're able to come out to get the necessary help, reach out to the health team that has responsibility for reviewing and ensuring that they provide them the right guidance on what to do. So when people comply with that, they can get over the infection and then remain safe. And that should not be a passport or an excuse to discriminate against anyone.
What's the role of family in all of this? I'm talking about stages of association that we go into. Role of family in all of this.
Yes, the family is a very key entity because everything that we do actually starts from the home. If individuals, in their homes, tell each other and educate each other on what to do to comply or to adhere to those safety measures, is the beginning of ensuring that our communities, collectively take up the action that is required to remain safe. So the family is actually the nucleus, the beginning, and the foundation of ensuring that our safety and preventive measures are being complied with.
Well, we're getting signals from the world. Russia had come out that it has the vaccine to treat COVID-19, but again, that's been subject of discussion, all over the world. But before we get over it, now we know that we're in a new normal, and the question is, can we get out of the new normal when we get vaccine to treat COVID-19? But just before we do that, with our local, situation here, that some of us would have just go to the local medicine man, the doctor in the neighborhood, and how much he can do to, and some people have come out clean. I would say that they have come out clean from just treatment that they have from the neighborhood doctor.
Well, it's very interesting, really, to say that up till this moment, all the claims to vaccine and all that, most countries are racing. The countries are in a race to produce a vaccine. And there's a heightened pressure to produce a vaccine globally. And then whatever breakthrough any country gets, people are in a hurry to present that whatever progress they presume to have made. So the Russian vaccine claim is still part of the trial. It's right now in a phase where humans are being, people have presented themselves to see whether the COVID-19 so-called COVID-19 vaccine has any effect or not. So time will tell. We have not reached a stage where confirmation can be provided, but we're optimistic, and we hope that it eventually turns out to be successful, because that's what the entire world is looking out for. But as at this moment, there's really no certified or verified vaccine that one would say yes has worked or is working. So time will tell, really.
Okay, Doctor, just before we're going to break, I just, put this across to you. So much, dependence on government in the fight against COVID-19 here, and, America is talking about the second phase of palliatives. What happened in the first stage in Nigeria? Well, we all have our stories to tell, but so much dependence on government to be, to take care, or even of the face mask that we were talking about. Why is so much, dependence of government to just do it for us when we have, when we can all, just go about with the protocols that have been put on ground?
Well, definitely. Yes, in situations of this nature, government has a responsibility to ensure the public good, ensure that its citizens are safe, and also ensure that the health and the general well-being of its people are well taken care of. And that's why you see a lot of the efforts coming from the government side to ensure that it keeps people safe and protected from any ravaging effect of any pandemic or epidemic of an infectious disease. And this is not different. And again, you look at our economic situation, almost 70 or so % of our people are actually living below the poverty line. So one would expect that in such situation, the government will do all it can to provide some sort of palliative or support to people well and going, because it needs its people to progress, it needs its people to ensure development and to also preserve the humanity or the human race that we have in our society. So our dependence on government is not peculiar to states like Kaduna. It's almost everywhere in the country and the rest of the world. Especially
we don't want to go into any round of palliatives again, Doctor.
Yes, what we expect is for people to be able to go about securing their livelihoods, and then having what it takes to survive the current situation, and be able to live with it, successfully.
Okay, Dr. Zainab Idris Kwaru, we'll join you after this break.
Thank you.
We'll be right back after this quick commercial break. Are you serious? Victor FM.
Welcome back. Here's the program Perspectives this morning, coming to you on Invicta 98.9. And we are with Dr. Zainab Idris Kwaru, public health physician and lecturer with the Kaduna State University and community of the Community Health Department. She's also of the COVID-19 emergency unit of the COVID-19 for Kaduna State. And we're talking about COVID-19 and its reality and facts about it. Doctor, just before we went on that break, I was talking to you about, or we were talking about the community doctor, or what some of us will refer to as the neighborhood doctor. And for symptoms of that we get that will require doctor's attention, we all go, and of course self-medication is into all of these. We all, treat ourselves from ailments that we know about, malaria, fever, and all of that. But, talking about the symptoms that can be associated or related to COVID-19, what are the signs that we must look out for, and why we must, go to see the doctor, or, where, attention of the doctor or medical personnel must be brought in here on COVID-19?
Yes, I think the message here is for people to be on the lookout. We all know that COVID-19 is a respiratory related illness. So what that means is that it's a number of the key features are related to our respiratory system. So the key features remain when people are coughing, or when they have a fever, and then they also have difficulty in breathing or shortness of breath. These are classical features of the COVID-19. But in addition, we've had individuals that have a loss of sense of smell, a loss of sense of taste. They lose their appetite, and they're not able to actually perceive any taste. So any sign of that nature is really something that requires individuals to call the numbers that we continually emphasize for people to be reached out to by the team responsible for evaluating and reviewing, and coming out to probably do the test that is required to confirm whether an individual has COVID-19 or not. And one of the key measures we encourage people to do if they have some of these symptoms is to isolate. First of all, isolate themselves until the health team actually reaches out to them to do the evaluation, so that they are not mingling with the public, and that can constitute an issue on its own. Yeah, so these are the things we encourage people to do, so that they don't expose others to the infection and eventually they have it themselves.
Okay, the health team that you're talking about, how reachable are they? We are in the metropolis, so we can say, we know where to go to, who to call. But talking about the suburbs too, and the, hinterlands, how reachable are they?
Well, we do have call numbers that we continually call out for people to call once they suspect that they may have been harboring the infection. So that's what we expect people to call, so that help can reach them in good time.
For Kaduna State, we've had the mobile transmission where we can go for tests and all of that, and we were made to understand that it's for a period. If that has moved out of Kaduna State, how again are we going about testing and how people are coming? Are you satisfied with the level of people coming out to say that they just might be infected with COVID-19?
Well, it's important for people to disclose if for any reason they are exposed and they suspect that they have the infection. It's very important for people to come out to alert the team, like I said, so that team can reach out to them and provide them the help and the support that they require to recover from the ailment. Having said that, it's also important for individuals to understand that we wouldn't want, if one suspects that they have the infection, for them to be roaming around, because there's a tendency that they continue to shed the virus, and in that way infect a lot more people in the process. So that's what we mean by saying that it's important for individuals to know. And I think a lot of publicity has been given to those numbers. I'll try to get us the number before the end of this program, so that people can note it down. Peradventure, they need to call the numbers to solicit for more information on what to do if there's any suspected case, or if they themselves suspect that they are carrying the virus.
Talking about treatment, again, we've had people that have come out, after, testing positive, they've come out after being treated. We're talking about treatment now. The testimonials, how much of it, can we get or available to us to say that, of course, those that still don't believe that COVID-19 is a reality, what about the testimonials? Are we getting enough of it?
Yes, we have individuals that have come out to disclose and to come out in the public to testify that they were going through, they've experienced it, but they have recovered from the ailment. So we have individuals like that are coming out day in, day out to disclose the situation or the experiences that they have gone through.
Is it an exclusive treatment of government, and individuals are not charged any, as we've been told?
Yes, definitely. For now, this is what the government is supporting, and all of them. It's not really. It's a huge amount of money and resources that are being spent on each case that is being managed. Right from the time they are tested, the items that are used to be tested are things that are procured by government, or when donations come from philanthropies and other corporate bodies. But these are resources that are being bought and that are being used to deployed to manage the cases as they come.
Let's talk about the situation of health workers. Those are the front line. At the heat of it, we had that we were having cases of health workers being infected too. What's the situation now?
I think proactive measures have been taken. The health workers have received a series of trainings on infection prevention and control, and then the items, the personal protective equipment that is required has been provided in almost all of our facilities, both primary and secondary care facilities. Those items have been provided, and then even at the time our health workers were coming down with the infection, is because some have not really also complied, and then because of the exposure that they had, sometimes they are not aware of who is carrying the infection, and when they present in our hospitals or facilities, they also tend to be exposed. And some have been found not to even contract the infection in the hospital environment, but rather from their communities. So these are the issues that we have, but thankfully that is being addressed, and a number of our health workers now are complying and really doing the needful to remain safe in order for them to be able to provide the needed care to clients or patients that patronize on facilities.
Doctor, too, a lot of things have been relaxed on COVID-19. We're talking about measures that have been put in place at the heat of it. And now we move into states, from our own states, and we have our markets opened now. The schools are gradually getting opened for all. And with all of these, and the government, that some people say government has relaxed its like the courts that we have, the mobile courts that we have, on offenders, so to say, on protocols that are not observed. All of this relaxed, and again, I'm worried about the markets too here, where of course face masking is very important, about it, and washing of hands. But crowded area where you have movement and of course rubbing of shoulders, can we avoid all of this, even if as we get our markets opened?
Yes, I would say that nothing from the government side is relaxed. Government has continued to emphasize the need to step up or act in terms of, complying with these preventive measures and utilizing the sanitary facilities that have been provided, like the hand washing facilities. It is all about the attitude of our people that has relaxed, but not that the protocols or the guidelines have been relaxed. And then when we talk about the mobile code, of course, it's not in our purview. We know that there's another body or institution that is responsible for that, which should actually be available to help enforce the guidelines and to also ensure that people are complying and obeying all of the directives that are being provided. And that for us is a huge challenge, because in as much as we're providing the messages and emphasizing and communicating, it's important that we have a structure in place that will enforce or sanction any violation to these rules or guidelines. And we don't have that mandate, except for the Quarantine Act, which we have. And we hope that through our environmental health officers, we should be able to have such guidelines being complied with. And they will help us to actually ensure that people are keeping to the rules.
Well, some people say COVID-19 has exposed, the health sector, the inadequacies and all of that, and of course, and personnel and all it takes from the health sector. For now that we are facing this reality, not that we want another one to come, another pandemic of any sort to come, but again, the health sector and what government must do about, the health sector. What are some of the observations that you have on the health sector and the challenges with COVID-19?
What I can say in that is that it's important, and I think government is also doing that to ensure that we are able to sustain, or to reinforce and build up our hospitals, and to also strengthen the system to ensure that we're able to cope with whatever condition people present in such facilities. It's an opportunity for us to look at the gap that we have and to make sure that the necessary equipment is being provided, the right manpower is available, and the health workers have the necessary training to be able to cope and to manage the cases as they come. So this is already happening. Like I said earlier on, series of trainings have gone on where our health workers have been they've gone through refreshers, they've been taken through what they need to do to provide care in the pandemic situation, and that I think has strengthened that human capacity to provide such care. And then equipment and items have also been provided, but like I said, these are areas where a lot more will continue to be done to ensure that we have the systems that can cope with any challenge now and also in the future.
Okay, let's come to our audience now and be part of this conversation. And COVID-19, what the situation is, in your area, and of course, areas you'd want to, get the doctor's attention on. And numbers to call to be part of this program: 081 40,000 989, 081 40,000 989, or 070 800 989, 070 800 989. Numbers to call to be part of this program. Hello, good morning.
Good morning, Mr.
Good morning.
To the doctor.
Can I get the name again?
My name is Chief Amote.
Okay, Chief Amote.
My question goes like this. Now, there is testimonies and testifiers. Please, can we get to a day, give us a day that we should wait on this platform? Those testifiers will come down and tell us how did they go through, and what did they go through, and what did the government or what did the health sector use to treat them, so that so many of us will not believe that all these stories we are hearing every day is true. Now, there is some states also that said that nothing like COVID-19 in their state, and I'm still believing with them that everything is still going okay. Does it mean that the data not clean back again at the clip and not day sharp, based on this other states that are giving numbers every day by day without seeing no good hospital? Even as I'm talking to you now, I can bet you that no good facilities in Sabo precisely. We left General Hospital in Southern Texas. Mr. Taylor, so that will not be the issue around the bush. If I can come to the studio and take the doctor, let's go to the hospital, wait, go close to me. Then we will not pass down. This is what they are doing. And we, if you believe that the government has failed us, that's why some of us don't believe all these stories every day by day. And again, let me round this up with what are the government for this COVID-19? What is their situation about these IPTs? How are they trying to maybe to check them, test them, till they have pushed them out of their houses where they live, and now they are in IDP camps? And we still have those people being treated. And those Alamadrians that bring this population before, especially in Kaduna, where are they? And they are being treated.
Okay,
they come for the testing.
All right.
Thank you and God bless you.
All right, Chief Amotekunle. Well, I'll come straight to you, Dr. Zainab. Like we've been talking, some people still think that COVID-19 is just a story. And with what the caller had said, he's worried that we're not seeing the testimonies of COVID-19, seeing those that have been infected and coming out clean. And of course, he's worried also about the situation with the IDPs. How we're going into this area, what government is doing in this area too.
All right. Let me quickly say that Chief Amotekun has expressed some of the key sentiments going on in our communities, which is still having people not believing that COVID-19 is real. Of course, I think it's high time people realize that COVID-19 is here and has really caused a lot of havoc in the lives of some people. So it's really quite all right. And if anyone doesn't still believe, it's rather unfortunate, because that kind of attitude tends to expose individuals and put others at risk of contracting the infection. And this is one of the reasons why we have people being nonchalant and not complying with the rules as expected. So I think people really need to realize that this is not a healthy development with such attitude and behavior. And then not seeing enough of the testimonies, let us also realize that people have a right to either come out to disclose or not to disclose their status. It's a right that we have been trained to respect. And if they don't on their own come out to disclose their status, it would be very, very unethical for us to come out and begin to expose the names of those individuals that have gone through. We expect that anyone, of course they do that also because of the fear of stigma and discrimination. So, but we expect that for those that are able to come out to really give testimony, we encourage them to do that. If for nothing, at least to prove to individuals out there that this epidemic is real and people suffer from it, and they wouldn't want anyone to go through the same experience as they have. So it's important for us to see that, and we encourage individuals that have had the infection and have recovered to help us come out, even if it's within their communities, their relations, their neighborhoods, to actually discuss the condition and help to spread the message of preventive measures and staying safe. Then the situation with the IDP camps that he alluded to, we have a body that has responsibility for looking out and taking charge when situations like this come up. But for us in the health sector, we look at the health component of whatever emergency response is being put. And there are teams that have been trained. And right now that I'm speaking to you, I think they've gone all out to ensure that they respond to the plight of those in those IDP camps. And all necessary support is being provided to make sure that they also remain safe. And peradventure, because of the nature of their condition, it does not become a breeding ground or for the spread of the virus or the infection. Thank you.
All right, still with your calls, still taking your calls. Hello, good morning.
Hello, good morning.
Good morning.
And good morning to the guest. Yeah, your guests have spoken.
Hello? Okay, I guess we lost that call. Hello, good morning. Hello, good morning. Okay. We're having problems there, and just still go on with the numbers. We'll stay here with you. We're here with Dr. Zainab Idris Kwaru. Hello, good morning.
Hello, good morning.
Yes,
How are you?
we good.
Your guest has spoken. I am Luca Adua calling from Marabarido.
Okay, Luca.
Yes, I want to appreciate the government of Kaduna State for its own toward this COVID-19. In fact, right from the inception of this COVID-19, if other states had strived just like Kaduna State, probably would have not been talking what we are talking today. One thing I want to ask the guest is with regards to this Kaduna refinery. Absolutely, they are not helping matters because Kaduna refinery has the financial motives that they can at least provide an isolation center for its own host community, as well as testing centers. But it's like the refinery does not care about the host community. So that's why I'm asking the guests, what can the government do for this host community in respect of the NNPC to provide all those things I've just mentioned, like the testing center and as well as the isolation center, because they have the financial models to do that.
All right.
Thank you.
Okay, Dr. Zainab. Well,
Yeah, this is beyond me. It's not my
yes, yeah, I guess so.
Responsibilities of government and the organization concerned that he mentioned.
Yes. Yeah.
And I'm sure they've had him.
Yeah. Okay. All right, look, I'm sure NNPC would respond to you appropriately. Stay with calls. Hello, good morning.
Hello, good morning, sir.
Good morning.
My name is Kingsley. I'm
Kingsley.
calling from Sabo.
All right, Kingsley, let's hear you.
Yes, I want to ask a question. So I'm worried about this COVID-19. It's real. Now, my question is, what has Kaduna State government done in the area of testing all these SS3, students that are writing WAEC? Did they test all of them? If the answer is yes, so what is the necessary measure are they going to take in case if there's any outbreak of COVID-19 among the students? I was listening to press review this morning, paper review, and they said that some students were tested positive either in Jigawa State. So that's my question. What measures are they putting in place in case such thing happens? Thank you.
All right, Kingsley. Well, Doctor, on Kaduna State, reopening of schools, what steps have been taken? And of course, what we're hearing that some students have tested positive, not in Kaduna State anyway.
Okay, I would want to say that Kaduna really went out of its way to do a lot before the SS3 students were allowed to go back to school to take their exams. For instance, series of meetings held with the key authorities from these schools, both public and private, and agreements were reached, guidelines were provided on the conduct of resuming to school by those students, the staff, and other workers within those environment. In addition, the government also went out of its way to provide most of these schools with personal protective equipment, especially the face mask, and then the sanitary facilities, hand washing facilities, and so on and so forth. And I think one of the other things that happened was the training of some of the authorities that need to take responsibility on what to do when the students resume school, and even the number of students that need to be in a class, not holding assemblies, making sure that minimally those students also comply and observe the preventive measures. And in addition, the schools were also inspected to ensure that they have facilities for isolation in case any student comes down with features of the of the infection, some sort of holding area where they can temporarily keep those students before the key health authorities reach out to them. So that has been done, and right now the students are carrying out their examination, and all of these rules are being observed, and we hope that we do not experience any incident where a student comes down with the infection, or their teachers or any worker within those school environment. So a lot of that has been done by the Kaduna State government.
Okay, Doctor, this will just be our last call. Yes, we'll take this call to close it. Hello, good morning. Hello, good morning.
Hello, good morning.
Yes.
My name is Mike Baba from Romy.
Mike, quickly.
Yeah. Please, I just want to chip in with the word. You see, some of these commercial vehicle drivers are not helping matters. I was enjoying yesterday. Honestly, the whole of the passengers inside use face masks, except the driver himself. So I think they should checkmate this type of people.
Okay.
They are not helping matters.
All right.
Thank you.
Okay, thank you, Mike. Thank you. Well, Doctor, let's get your last line on this.
Okay, about the commercial transport
Yes, and generally
issue,
round up for us.
overcrowding and all that. We've said at times with that number that these are avenues or practices that can predispose people to getting the infection. We have too many people in a vehicle, and then especially if they are not observing the guidelines, no social distancing, some not using face masks, and then breathing around each other, coughing, sneezing, and so on. So that's a breeding ground for transmission or spread of the infection. And that's why one of the guidelines for our transport sector is to ensure that the public transports or the commercial transports really comply by keeping not more than 2 people per sitting arrangement. And if that is not being observed, honestly, that's the other behavior that is detrimental to the efforts that have been put in place so far. So we encourage people, when they are embarking on any public transport, they should also talk to each other and ensure that the drivers, the passengers, all comply with the safety and preventive measures that have been prescribed for that sector.
Okay, Dr. Zainab Idris Kwaru, always a delight talking with you. That will just be about the size of the program. Thank you for coming on the program.
It's my pleasure, and thank you for inviting me.
All right. And that's it with Perspectives this morning, and courtesy of Kaduna State Ministry of Health. We'll come back with the program tomorrow. We'll say good morning, and Morpheus, thank you for connecting us with the people. Wisdom, thank you for putting us in the pictures this morning. Good morning.